Thank you so much for choosing to spend your time with me today and talking about flourishing by feeding your flora. This is a topic that's very near and dear to my heart. It's the reason that I'm sitting in front of you here today. I come from poor health and poor gut health, so this is something that I love sharing with people. And hopefully, you are here to learn more, to help yourself, and to help others. And as mentioned, you can ask questions as we go along, just putting it into the Q&A box. So a little bit about myself. My name is Caroline Farquhar. I'm a registered holistic nutritionist, and I'm also a medical advisor at CanPrev. I've been in the industry. I've had over 19 years now of experience in health education. And my specialty is digestive care, cleansing, as well as hormone health. I also taught at the Canadian School of Natural Nutrition for 4 years, and I'm certified as an energy medicine practitioner, a Reiki master, and I also have a psychology degree. Why is that important? Well, I combine mind, body, and spirit into a holistic approach to well-being because it's so much more than just, what you're eating. It could be so many things that have happened throughout your life to kind of bring you here today. So that's what I look at. I look at a whole holistic approach, and that's what registered holistic nutritionists do. They take that whole holistic approach and help with so many different things. So very, very glad that you're here with me today. But this is where it all started. When I was about 5, this is 5-year-old me, and I struggled with digestive issues most of my life. And when I was young, I would get nausea, I'd get diarrhea. Felt sick a lot of the times. I would always wake up and kind of feel uneasy, and my stomach would always feel uneasy. So a lot of things happening when I was a little kid, contributing to this. And this is, I think, in this day and age with our own children, that a lot of them have stress and anxiety, and they have gut issues. And so you can kind of see that connection. So for me, it started when I was about this young. But then at 35, I had diarrhea, vomiting multiple times a day. I was quite sick. And I went to the doctor, and they couldn't really find anything wrong with me. And they said, you probably have irritable bowel syndrome, which is a diagnosis of exclusion. When they can't find anything, that might be a diagnosis that they give to you. And then my doctor said, you might want to go see a psychiatrist. So I thought, wait a minute, like, you're thinking it's all in my head. I was a little frustrated. But a friend of mine who was going back to school to become an RHN, she said, it sounds like you have candida. And those words changed my life. And so I went to homeopath. I listened to my gut. I listened to her, went to homeopath, and she found homeopathic remedies that worked for me. And I was probably feeling better within about a week, and after having symptoms for a very long time. And that really honestly changed my whole trajectory of my life. So I went back to school. I became a registered holistic nutritionist, and I've been doing this ever since. So I'm not just speaking to you from reading articles or, doing research. It's coming from my own personal experience, but also the experience of thousands of people over the last 19 years that I've spoken to, and that have come to me and said, like, you understand what I'm talking about. And it's because I am you, like, I've been through it. So I understand where people are coming from. So that's a little bit about me. But here's something really exciting about tonight is we are doing a gut reset giveaway. So Healthy Planet is going to give away all these 6 products. It's a $250 value. You just need to hang on till the end of the presentation to learn a little more about it. So let's begin. Why is gut health important? It's important for so many reasons. So a balanced gut can ensure efficient nutrient absorption. It helps to strengthen the immune system. It supports a stable mood. And this ultimately contributes to overall health and vitality. So much of your health does come back to the gut and the state of your gut health. So how does that happen? Let's dive in. Say hello to your gut microbiome. So the gut microbiome is a collection of trillions of microorganisms, including bacteria, fungi, viruses, and other microbes that inhabit the digestive tract, and particularly the intestinal tract. Now, we're talking about the gut microbiome here, but There is a microbiome for your skin. So that would be your skin surface as well as the pores. You've got an oral microbiome, which is your mouth, your gums, your tongue, a respiratory tract microbiome, which is the nose and the lungs. And then there's also microbiome in your urogenital tract, which is your vaginal and urinary microbiota. The reason I mention that is you might see probiotics in different products. So you might see it in skincare. Those would be probiotics that are specific to skin. Or if you're looking for probiotics on the shelf, there's certain strains that do certain things in your body. So there's certain strains that help with the urogenital tract for women. Maybe they're having problems with UTIs or candida infection or sorry, yeast infection. So I tell you that because there is more than one microbiome, but today we're talking about the gut microbiome in particular. From the time that we're in our mother's womb, healthful microbes are setting the stage for our immune system to mature. And as you grow, your gut microbiome diversifies and acquires many different types of microbial species. In fact, early life imbalance has been associated with an increased incidence of allergies and autoimmune diseases later in life. So there's more than 10,000 species that live on or in your body. And across the human population, there's close to 150,000 different strains. So that's quite a huge diversity. And there's over 1,000 possible microbial species in your mouth right now. There's 150 behind your ear. There's 440 on the inside of your forearm. And your mouth and your gut are more different than a polar ice cap and a hot spring. So even your left and right hands only have 17% of microbes in common. So it's absolutely fascinating. They started the microbiome research. 2007 ended up in 2020. No, 2003 ended up in 2013. So it was a 10-year project. They're still mapping out the microbiome. And we're still learning so much about it and what these microbes do in our body and what they do for us and how we live symbiotically with them. So it's really exciting time to be in this industry and learn all the things that microbes could do for us. Now, there are certain factors that affect our microbial diversity. And the first one is what happens when you first start out in this life is your type of birth, whether it is a vaginal or a C-section. So vaginal delivery introduces a baby to numerous strains of bacteria as it passes through the birth canal. And infants born vaginally have well-established gut bacteria, usually about a month after birth. Now, cesarean-born kids don't have the same type or amount of bacteria as infants born vaginally, and their intestinal flora can be disturbed and poorly established even 6 months after birth. So I know that more people are choosing cesarean birth for convenience, but it's really not the best thing. So if you don't have to, then don't do it, is where I would go with that. Now, the next thing is breastfeeding versus formula fed. And there's a lot of research to show that breastfed infants initially establish a different bacterial composition than formula-fed infants. So when 1-week-old infants were compared, bifidobacteria, which live in the large intestine, are present in greater numbers in the stools of the breastfed infants than the formula-fed infants. And the incidence of C. difficile, which causes like really bad watery diarrhea, it was higher in formula-fed infants at about 49 to 66%, as opposed to breastfed infants, which was only 6 to 20%. So quite a big difference. And here's where Mother Nature shows up really strong. This is pretty cool. In 2013, a study in clinical immunology showed that up to 70% of cells found in colostrum are leukocytes, which are healthy blood cells that fight infection. So a few days after childbirth, when normal breast milk begins to replace colostrum, the number of white blood cells that fight infections drops to about 2%. But here's the cool part. It's ready to increase at any sign of illness. So whether the mother or the baby gets sick, those percentage of leukocytes found in the milk increases back up to 94%. And that's more like the composition of white blood cells and colostrum. So it's pretty cool how Mother Nature just knows what she's doing. Another thing that can affect your microbial diversity is your country of birth. So I think a lot of us might have maybe experienced this at some point in our life, is that, you know, you have no problems with the food or water around you, but then you go some other country and all of a sudden you've got Montezuma's revenge, or, you know, you're dealing with stomach cramps or diarrhea or something like that. And the locals aren't having a problem. That's because they're used to the bacteria that are around them. Diet has a big factor as well. So there are certain things that will help feed your good bacteria, and there's certain things that will kill off your good bacteria and feed bad bacteria. So, you know, fiber is very, very good. You want to get more fiber in your diet. You want to stay away from things like sugar, which can suppress the immune system, but can also feed the bad bacteria. And of course, then you can have an imbalance. Medication really affects microbial diversity, but it's not just antibiotics. There's over 1,000 different medications that can affect your microbial diversity. Stress affects so many things, but it also affects your microbiome. Toxicity, whether you eat it, breathe it, drink it, these types of things can also affect your microbial diversity and create an imbalance. And then as you age, just naturally as you get older, your good population of bacteria starts to decline. You might notice things like more gas and bloating. Maybe you've got more constipation or you've got more diarrhea. So we know that things like probiotics can really help with something like that. And there's certain strains that are particularly helpful for things like transit time through the body. So there's a few functions that the gut microbiome does for us. And I think the first one is the most obvious, and that would be digestion. So the gut microbiome helps break down complex carbohydrates and fibers that our bodies can't digest on their own. Through fermentation in the large intestine, these microbes produce short chain fatty acids like butyrate, acetate, and propionate. And short chain fatty acids provide energy for colon cells. They help maintain the gut lining, they help reduce inflammation, and support overall metabolism and immune function. So making fiber not just good for digestive health, but also for overall health. So how much fiber should we be getting in a day? We should be getting anywhere between 35 and 45 grams a day. Canadians are getting between 8 and 10. So we're not even close to where we need to be. So try to get more in your diet. And if not, you can supplement. And I will talk about one of our fiber products towards the end. Now, the microbiome is also crucial for our immune system, and it plays a key role in immunity by training the immune system to recognize harmful invaders and promote a balanced response. It helps maintain the gut barrier, preventing pathogens from entering the bloodstream, and produces anti-inflammatory compounds that reduce harmful immune reactions. And a healthy microbiome also competes with harmful microbes, limiting their growth and supporting overall immune defense. So the way that I think of the bacteria and the microbes in our digestive tract is they're like little soldiers. They're the ones that'll say, okay, you're good, I'll let you in, or no, you're not allowed in, and start mounting an immune response. But then I also, again, think of the body like an apartment building, and you want more good tenants than bad tenants. You want more good bacteria than bad bacteria. And so you want that good bacteria to help crowd out the bad bacteria. And it's also very important when it comes to metabolism. So the gut microbiome influences metabolism by helping break down food, producing short chain fatty acids that regulate energy use, and affecting how the body stores fat. So it also impacts hormone levels related to hunger and blood sugar control, like insulin and GLP-1. And a balanced microbiome supports healthy weight and metabolic function, while imbalances can contribute to obesity and diabetes. Some bacteria can actually make you fat. We know that through some of the research now. There's bacteria that make you fat, and there's bacteria that can help keep you thin. So again, it's all about balance. You want to have a lot of diversity in there, and you want to have a balance of more good bacteria. Bad bacteria, there's a time and a place, but you definitely want to have more of the good bacteria. And I think over the years, especially through, the COVID years, we'll call them, a lot of people they were very afraid of germs and of bacteria, and using a lot of antibacterial hand wash and that stuff. But there are microbes that are good for you, and we need them. So killing them off, across the board, not necessarily the best thing. Now, the gut microbiome also supports mental health through the gut-brain axis, and it's a communication network linking the gut and the brain. So I think a lot of us are starting to hear more about the gut-brain connection. And gut bacteria produce neurotransmitters like serotonin and GABA, which influence mood and stress levels. They also help regulate, they also help regulate inflammation and the stress response, both of which are linked to anxiety and depression. A healthy microbiome is associated with better mood, reduced stress, and improved cognitive function. So that is done through the gut-brain axis. So the gut-brain axis is connected both physically as well as biochemically through the vagus nerve, gut hormone signaling, the immune system, tryptophan metabolism, as well as microbial metabolites like short-chain fatty acids. So it's a bidirectional communication between the central and the enteric nervous system, and it links emotional and cognitive centers of the brain with these intestinal functions. So sometimes you might think something and you might feel sick, or sometimes you might feel sick and then you start getting depressed or anxious. So there is that two-way connection there. So I mentioned the vagus nerve. What is that? I'm not talking Las Vegas here. So the vagus nerve connects the brain to the gut, and it can help regulate digestion, send signals to the brain about the state of the gut, and dysfunction can contribute to digestive issues like bloating, indigestion, or constipation. So the vagus nerve is the longest cranial nerve in the body. And it connects the brain to the heart, the lungs, the digestive tract. So it runs very, very far throughout the body. And it does play a very key role in regulating, the digestion, the heart rate, mood, and it carries signals back and forth. And it helps control digestion by regulating the release of digestive enzymes, stomach acid, and gut motility. So when you're stressed out, do you notice that you might have more stomach acid, that you're not breaking down your food properly, you're getting more gas and bloating, maybe you're getting more constipation because things aren't moving as quickly. But it also relays that information from the gut back to the brain, helping to regulate things like hunger, fullness, digestive activity, while also influencing that mood and emotional balance I was talking about. So a well-functioning vagus nerve supports relaxation. It's that rest and digest nervous system. It reduces stress, promotes healthy digestion, and dysfunction can contribute to those gut issues I was mentioning, as well as mood disorders like anxiety or depression. So the key is to keep the vagus nerve happy. And there's things that you can do to promote good vagal tone. And you can Google that, but I'm going to give you a couple of things later on to tell you, give you hints to help you to stimulate your vagus nerve. Any questions so far, Rose?
Yeah, there's quite a few. Some of them are somewhat relevant to what you've gone over, and some of them are maybe better left to the end. Did you want to go through some of them already?
Yeah, we can talk about a couple before I keep going.
Okay, so Annette had started, I'm gonna answer this one live. Annette had asked, I had my gallbladder removed about 20 years ago, looking for the best way to digest without gas and bloating.
Ooh, digestive enzymes are probably going to be your best friend, but especially lipase. That helps your body to break down fat. And then I think TUDCA would probably help too when it comes to digesting fats, because that's the problem that you're having. And so eating fats on their own is not a good idea. You want to make sure you're eating it with other food. But digestive enzymes are probably going to be your best friend, and certainly one that has lipase in it.
Yeah, Tudco was a good suggestion too, because it's a bile salt.
Yeah.
She also had said, also, I experience migraines monthly. Could they be related to my digestion?
It could be if you're especially, okay, I'm probably going way off topic and maybe I shouldn't answer these questions now. You know what? Let's hold off the questions to the end. And especially that one, we'll start off with that one because I don't want to record that. I'm not supposed to be really giving advice. So I want to take that offline so that we're not recording it. So let's just, I guess, I thought it would be easier, but let's do the questions at the end.
Okay, we'll save
All
the
right.
questions for the end, but keep putting them in the Q&A box. Thanks.
Okay, perfect. All right. So as I mentioned, it's a two-way street. It's not just the vagus nerve that sends signals. The gut contains millions of neurons that send signals to the brain about digestion, inflammation, and overall gut health. So you can see the gut to the brain. So the gut contains millions of neurons and they send those signals. And then the brain back to the gut through the central nervous system regulates gut functions such as motility, digestion, and the release of digestive enzymes. So very much a cyclical sort of process going on here. And this connection plays a crucial role in health and disease, impacting conditions like anxiety, depression, as well as irritable bowel syndrome. So I mentioned a few minutes ago about neurotransmitters, and neurotransmitters play key roles in both the brain and the gut. So there's that connection again. In fact, the enteric nervous system makes use of 30 different neurotransmitters, but we're going to focus on 4 in particular. And the first one is GABA. And it's a neurotransmitter that acts as the brain's main calming chemical. It's primarily an inhibitory neurotransmitter and helps regulate gut motility, helps reduce stress and anxiety, and promotes a calm digestive system. It also helps slow down nerve activity, promoting relaxation and supporting sleep, and plays a role in muscle tone and overall nervous system balance. So if you're one of those people that gets stressed out and your stomach just like shuts down and you're not hungry or you feel nauseous, GABA might be something that you might want to add into your routine. Now, serotonin, this is interesting. About 90% of serotonin is actually produced in the gut. And it regulates gut motility, bowel function, and plays a role in mood regulation. And imbalances can lead to digestive issues like IBS. So it's a neurotransmitter that helps regulate mood, sleep, appetite, digestion, and it's also referred to as that feel-good chemical. So it contributes to the feelings of well-being and happiness. And as I mentioned, 90% of serotonin is produced in the gut, and 95% of the body's serotonin actually resides within the gastrointestinal tract, not in your brain. Now, dopamine is mainly associated with mood, reward, motivation, and pleasure. And it's the neurotransmitter also influences the gut motility and can affect digestion. Imbalances may disrupt digestive processes and contribute to gut disorders. So 50% of your dopamine is synthesized in the gut, and it is regulated by gut bacteria. And the last one is norepinephrine. And it's both a neurotransmitter as well as a hormone. And it helps regulate the body's fight or flight response. So it increases heart rate, blood flow, and glucose release, preparing the body for action during stress or danger, which can impact digestion, especially during periods of anxiety or stress. So if you have to run from a lion or if you have to fight somebody, you're not going to be stopping and resting and digesting. So this is why it's, norepinephrine is going to rev you up and get you ready to fight, and it's going to shut the digestion down. So norepinephrine is really important to stay calm. You don't want to always be in that high stress state, but unfortunately, in today's society, there is a lot of stress. So as you can see, all those neurotransmitters together help maintain a healthy gut environment, and imbalances can contribute to digestive and also mood disorders. So it kind of goes both ways. Let's dive into the gut immune connection now. So gut-associated lymphoid tissue represents almost 70% of the entire immune system. It's home to a large number of immune cells, including the T and B cells that identify pathogens and sound the alarm in the presence of harmful bacteria or viruses. And gut imbalances can lead to chronic inflammation, autoimmune conditions, and increased susceptibility to infections. So you can see on the right-hand side there, you can see it looks almost like a train track. Those would be, and you can see the little like pokey outy things on the left-hand side. Those are microvilli, and that's what absorbs your nutrients into your body. So this would be your small intestine here. And so what that does is it helps, once your body breaks down the nutrients, it comes through the microvilli, goes into the bloodstream, and then it goes to the body, and your body uses it for whatever it needs to do. When there is damage there, and you can see there's a little damage, there's a few that have like open junctures there, that's when problem happens. That's leaky gut or intestinal permeability. And when that happens, then you have undigested proteins, you have, not so great bacteria, you might have viruses or pathogens come through, parasites, and they get into the bloodstream and they can go anywhere in the body. And the body views them as foreign invaders and starts attacking. Now, if that happens long term and attack, then you end up with things like autoimmune disorders. So it's very important to keep that digestive tract nice and strong. And I'll talk about some things that you can do to help that along. So there are lifestyle tips to strengthen your gut microbiome. There's a lot of things that are within our power to do every day, make some certain choices, and that could be things like healthy diet, exercise, adequate sleep, relaxation, and then high quality supplements. Supplements are there to supplement your lifestyle, and some of them are very, very beneficial. Some things you can't just do on your own, and you might need that extra help, and that's where CanPrev comes in. So here's some gut-friendly foods. We've got fermented foods like yogurt, kimchi, sauerkraut. They're rich in probiotics. Fiber-rich foods. We need 25 to 35 grams of fiber in your diet every day. So whole grains, legumes, fruits, veggies. If you're not getting it through your diet, you can supplement as well. Bone broth contains collagen and amino acids, which support gut lining and reduces inflammation. Ginger is known for its anti-inflammatory and digestive properties, and chia seeds, they're a powerhouse. They're packed with fiber, omega-3 fatty acids, but they also have protein. They're a great way to start your day. That's something that I personally do every day. I have fiber. I warm up some milk, or I use soy or almond milk, mix it up, and then I put in nuts and seeds and fruit, and it's a great way to start the day, and it keeps me feeling very full for a long time too. Exercise. Regular exercise supports gut health by boosting the diversity of microbial species within the gut and promoting the growth of beneficial bacteria. So most of the bacteria in your gut play a vital role in supporting body functions, while our bodies help maintain the health and growth of these microorganisms. So regular exercise enhances this process by boosting the diversity of microbial species in the gut and promoting the growth of beneficial bacteria. So I'm not saying you got to go to the gym and, beat your brains out on a machine. Going for walks, going for a swim, whatever makes you happy, try to get some exercise. 30 minutes every day would be a great way to just get that exercise into your routine. And then eventually your body's just going to want to do it. I don't know if, I'm sure a lot of you out there already do exercise, but that exercise high, and you just feel fantastic when you do some sort of exercise. Sleep. So research suggests that our microbiome is influenced by circadian rhythms. So getting enough sleep supports the ability of T cells to effectively combat infections. So you can look up sleep hygiene on the internet. So turn off your electronics about an hour before you go to sleep. Make sure your room's a comfortable temperature. So maybe you open the window and you got lots of covers. I was talking to my mom about that today. Maybe it's wearing, comfortable pajamas, all of those things. Set a routine, make it important part of your day so that your body recognizes, okay, it's time to go to bed. And that's when you rest and digest. And that is when your body is going to rest and repair. And it is so crucial. And one thing I can share is don't watch the news before you go to bed. And don't watch the news when you eat, because it's going to impair your digestion and it's going to impair your sleep, especially the news nowadays. And relaxation. So when relaxed, the body activates the parasympathetic nervous system. That is the rest and digest nervous system. And it promotes proper digestion, improves gut motility, and enhances the balance of beneficial gut bacteria. So that could be things like going for a walk. It could be, I love to walk in the woods and hug trees. That's my thing. I had a cat. I loved it when he would just lie on my chest and purr. That helped relax me like crazy. So maybe it's hanging out with your pet or crocheting or doing needlepoint. Whatever it is for you, find that thing and make it an important part of your day. Now, I talked about the vagus nerve a while ago, and I talked about good vagal tone. And so getting that vagus nerve to stimulate your parasympathetic digestive system is really important. And one of the things that I do, and it's very effective, and I'll do it right now, and you can do it along with me because I think you'll notice a difference. It's called VU breathing. I'm not sure if anybody's heard of it, but Peter Levine is the one who put it together. And so I'm going to do it now. I can do it 3 times. And you just breathe in and you say, Voo. 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 Okay. I'm feeling calmer. I notice I'm not speaking as quickly. What that does is it stimulates your vagus nerve. So when you do the VU, you feel the vibration on your throat and on the back of your neck, which is where your vagus nerve comes out. And what that does is it stimulates it. And then it just helps you to relax. So I use it in traffic. I use it before I do a presentation. So these things really help, the singing, chanting, lots of things, gargling, all of those things can help to stimulate your vagus nerve. So good vagal tone is very important for your nervous system. All right, so talked about all that. Now let's talk about supplemental support, because sometimes you do need the extra help. So first off is an obvious one, probiotics. They contain beneficial live bacteria that help maintain a healthy gut. Prebiotic fiber helps to feed beneficial gut bacteria. So probiotics are the good bacteria. Prebiotic feeds the probiotics. Digestive enzymes help to break down food, improving nutrient absorption. L-glutamine is an amino acid that supports the repair and maintenance of the gut lining. And colostrum helps repair the gut lining, enhances gut barrier function, and supports overall digestive function. So I'm going to dive into these a little bit more. So we've got the probiotic 50 billion extra strength. It is a shelf stable, so it's very convenient. You don't have to remember to go to the fridge to get it. It's a 1-a-day probiotic with 14 clinical strains, and each strain has been specifically selected to enhance the gut microbiome. And if you can't do a 50 billion, we do have other probiotics there as well. So you can check out your Healthy Planet store and see which probiotic would be best for you. Now, Fiber Feel, this is just acacia fiber. It's organic acacia fiber. It's very easy. It dissolves well. It doesn't taste like anything. And it's a friendly, natural acacia fiber soluble fiber. So it's a sap that runs out of the tree, and they just break it off and they grind it down into or they boil it, dry it, break it down into a fiber. And it's clinically studied to help your gut feel great. And this formula is quick dissolving, unflavored, and you can enjoy it in a smoothie, stir it into your favorite food, or simply mix in water. Honest to God, it does not taste like anything at all. So it's very, very easy to incorporate it into your life. And especially if you're not hitting that 25 to 35 gram mark, it's a great way to add fiber. So, you could do 2 scoops and get 8 grams right off the bat, or you can do it throughout the day. So it's easy to use, and it does not cause digestive upset. And it also helps to increase levels of healthy bifidobacteria, which is in your large intestine. So very, very good for your digestive tract. Now, digestive enzymes, this formula contains a full spectrum of 11 enzymes to help break down protein, carbohydrates, fat, fiber, dairy, and provides optimal nutrient absorption and digestion. When it comes to digestion, certain nutrients need certain enzymes to help break them down. So it's like a specific key to unlock a door. So carbohydrates need amylase, proteins need protease, fats need lipase. So this formula has all those different enzymes in it to help break down each specific nutrient. So if you're having gas and bloating when you eat, take a digestive enzyme. It can certainly help. Don't drink when you eat. And what's the other? Oh, chew really well and slow down when you eat. Those things can help with digestion. Now, magnesium. Magnesium is amazing. It does over 800 things in your body. So if nothing else, get some magnesium into your routine. It supports digestion by relaxing intestinal muscles, promoting regular bowel movements, and reduces bloating and constipation. It also helps balance gut bacteria and supports enzyme function for better nutrient absorption. Collagen is what that does is it supports a healthy gut by strengthening the gut lining, reducing inflammation, and promoting the repair of the intestinal wall. It contains amino acids like glycine and proline, which help maintain the integrity of the gut barrier to help support digestion. And this can improve gut health, reduce leaky gut symptoms, and enhance nutrient absorption. So CanPrev, in this case, this is our full spectrum collagen. So you'll see in that little white box there, 2 to 5 kDa. That is the size of kilodalton of the protein peptide. So protein peptides will help stimulate your body to produce, okay, so let's say bone. Bone needs a 5 kilodalton collagen peptide. And it's small enough to be absorbed and can support bone health by stimulating the osteoblast activity by promoting collagen synthesis in bone tissue. So that's good for bone. There's one that's good for muscles. There's one good for one that's good for joint and cartilage. There's one that's good for tendons, and there's one that's good for beauty. This one combines them all together. So it's good for all of that, but it is definitely good to help the gut as well. So when you go into the Healthy Planet, you see all these different collagens, you might think, oh, this is a collagen that they've added something to. It's not. We haven't added something. What we've done is specifically put in that specific size of protein peptide to stimulate collagen production in whatever part of the body that you need it. But if you want to cover all bases, the full spectrum is your best bet. Now, we also have gut repair, and together colostrum and calendula can work synergistically. So this has 400 milligrams of colostrum alongside calendula to help relieve inflammatory conditions of the digestive system, and in doing so, supports the immune system. And then GI Pro is a little bit different. This one helps to calm digestive disturbances, and it contains a perfect blend of amino acids and antioxidants that nourish cells in the intestinal walls and enhance gastrointestinal barrier function. So other ingredients work to deflate the uncomfortable feelings of fullness and bloating and support the complete digestion of food. So this one is more for acute symptoms of, gas and bloating, or if you're dealing with IBS where you've got the gas and bloating, you're kind of, floating between IBS-D and IBS-C. This is something that can help deal with some of those symptoms. And then last but not least, we have L-glutamine. I was mentioning this one a little bit earlier. Maybe I can't remember. So this provides 5 grams of pure fermented L-glutamine in each scoop. And it boosts, you can boost your daily nutrition. You simply mix it in with water, blend it into your smoothie. So L-glutamine is especially important for gut health. So when I talked about leaky gut, and I was talking about those holes in the intestinal tract, L-glutamine helps to deal with that, helps to repair it. So it's key fuel for intestinal cells and can help reduce inflammation and promote healing of the gut lining, helping to restore its barrier function. And it's the most abundant amino acid in the body, and it's required to maintain the health of rapidly dividing cells, including immune and gastrointestinal cells. So the cells in your GI tract will replace themselves every 3 to 5 days. L-glutamine is going to help you do it more efficiently. So that brings us to the end. And I just want to remind you of the Gut Reset giveaway. So Healthy Planet is going to randomly select an attendee and reach out to the winner directly. So they do have a list of everybody that has joined this call today, and your email address is on there, and they're going to contact you directly. And I'm going to leave this up because we do have some free resources. You can join our CanPrev community. We've got a 21-day gut reset course. We also have our gut microbiome primer that you can download. It's amazing, got some incredible information in there. And we also have our canprev.ca/recipes where you can check out some great gut happy recipes to try. And Rose has something exciting that she wants to share as well.
Hey, so yeah, just jumping on that, we have a really exciting giveaway going on our TikTok at the moment. If you are on TikTok, CanPrev has a giveaway where we're giving away $1,000 worth of CanPrev products. So if you want to try all of these products and more, just go follow us on TikTok. That's all you have to do, and go comment on one of our most recent giveaway posts. So that's another way to try and get more of these products into your hands.